So let me tell you about a patient I will call James. James is a 34-year-old man, healthy, active, no major medical issue, but he walked into my clinic looking more embarrassed than I see most patients in years. After a bit of prompting, he finally said it. Doctor, I'm thinking something is wrong with me. My size doesn't look the same as other men I've seen. When I'm not aroused, it looks much smaller, but when I am, it's completely normal. My partner has no complaint, but I'm convinced something is wrong with me. I smiled, not to dismiss him, but because I heard this before, many times and every time, and the answer is the same. So I said, James, you are a grower, and that is completely and medically, scientifically normal. Today, I want to have this same discussion with you because if you have ever wondered whether you are a grower or a shower, and whether it matters for your health or your relationship, you deserve the real answer back with real science today. Now, let's talk about it. I am Dr. Emmanuel, and on this channel, I break down men's health topic that most people are too embarrassed to Google, let alone ask their doctor, from sexual health to hormones, from urologists to the overall male wellness. And I believe that educated men make healthier decisions. And today's topic, it is one of the most searched men health questions on the internet and one of the most misunderstood. So we are talking about the grower versus the showers. Now let's define the terms. First thing first, what do these terms actually mean from a medical standpoint? In my clinic, when we talk about penile length, we differentiate between the two states: the flaccid state when the penis is at rest, and the erect state when there is full engorgement of the blood in the erectile tissue. A grower is someone whose penis increases significantly in length when transitioning from flaccid to erect. We're talking about a noticeable, measurable difference. Then a shower, on the other hand, is someone whose penis maintains a relatively consistent length between both states. What you see at rest is largely what you see when erect. They are simply different expressions of normal human anatomy. But here is where it gets interesting. There is a biology behind it. Now, what the penis is made of? The penis is composed of several types of tissue that directly influence how it behaves when flaccid versus when erect. This includes elastic fibers, collagens, smooth muscles, and a network of arteries and veins that manage blood flow. When a man is aroused, blood gushes into two main chambers of the penis, called the corpora cavernosa, and the penis becomes firm and elongated. The degree to which it elongates depends heavily on one key factor: the tissue elasticity. You see, elasticity is the key. Think of it like a rubber band. Some rubber bands, when relaxed, are already stretched fairly long. When you pull them, they extend but not dramatically. Other rubber bands are coiled tightly at rest, but when stretched, they can extend far beyond what you expect. Men with higher tissue elasticity in the penile shaft tend to be growers. Their tissue compresses significantly at rest but expands substantially when erect. Men with less elastic tissue, often due to a higher collagen density or stiffer fibers, tend to be showers. Their penis doesn't compress as much as rest. So, and there's also an influence of genetics and environment. This elastic quality is largely determined by genetics. Your DNA influences how much collagen versus elastic fibers your penile tissue contains, and this ratio varies from person to person based on the ancestry, family traits, and the individual biology. This is simply not something you choose or can easily change. But however, environment plays a role too. Factors like the body weight, smoking history, of physical fitness, diet quality, and even ambient temperature can influence how the penis appear in its flaccid state. A man who carries excess weight around the abdomen may visually appear to be a shower simply because more of the penile shaft is embedded in the surrounding fat tissues. This can change with weight loss. Stress, cold water, exercise, all of these can cause temporary changes in flaccid appearance. This is completely normal physiology. Now, let's talk about research. Because I know some of you want data and I respect that. You see, there is one key study that forms the foundation of what we know scientifically about growers versus showers. It was published in 2018 and it involved 274 male participants, all of whom were being evaluated for erectile dysfunction. The researcher gave the participants an intracavernosal injection, essentially a vasodilatation drug that is administered directly into the penis to produce a clinical erection, and then measure the penile length in both the flaccid and fully erect state. They defined a grower as someone with flaccid to erect length increase of 4 centimeters, which is roughly 1.5 inches or more. A shower was defined as someone with an increase of less than 4 centimeters. So what did they find? You see, the results were clear. 74% of participants were showers, while only 26% were growers. So in this sample, showers were the majority, though it's important to note this was a specific clinical population with erectile dysfunction, not a general population sample. Growers has a mean length increase of 5.3 centimeter, while showers increased by 3.1 centimeter on the average. So interestingly, growers also had a larger average erect length at 15.5 centimeter compared to 13.1 centimeter in the showers group. And the most significant predictor, which is age, younger men were significantly more likely to be growers. Growers had an average age of 47.5 years, while showers averaged 55.9 years. There was no difference between the two groups in race, smoking history, comorbidity, erectile function, or flaccid penile length. This tells us something important. Being a grower is not inherently healthier, and being a shower is not a sign of dysfunction. Age is the key variable. And by the way, if you are finding this video helpful, this is exactly what I do on this channel every single week. Real medical topics, real science, no embarrassment. Hit that subscribe button and join our community of men who are taking their health seriously. Now, back to the science. Here is something neither of the popular videos on this topic will tell you, and this is where I add real clinical value. A growing body of research has examined the ratio of smooth muscles to connective tissues within the corpora cavernosa of the penis. A landmark study published in the Journal of Urology found that men with higher percentage of smooth muscle tissues in the corpora have better erectile function, and crucially, the greater penile expansion capacity between the flaccid and the erect state. In other words, smooth muscles volume is directly tied to how much a penis can expand when erect. Men with smooth muscles are more likely to be growers. Men with more fibrotic or connective tissues, which increases naturally with age or is accelerated by conditions like diabetes, hypertension, smoking, tend towards shower patterns. And why does this matter clinically? It's because it means that maintaining cardiovascular health, managing blood sugar, quitting smoking, and staying physically active are not just good for your health, they are directly protective of the elastic, smooth muscles tissues that govern the penile health and expansion. You may not be able to choose whether you are a grower or a shower, but you can actively slow the tissue changes that shift you from one to the other over time. Taking care of your body is taking care of your sexual health. And does this affect your sex life? There is no clinical evidence that being a shower or a grower impacts sexual performance, erectile firmness, fertility, or partner satisfaction. None. So the problem is not anatomy. The problem is perception, and perception is something we can work on. If a patient came to me and said their concerns about the appearance were affecting their self-esteem or intimacy, I will not dismiss that. I will refer them to a specialist in sexual health psychology, and I'll also do what I'm doing right now, normalize it with education, because you are not broken, you are not abnormal, you are not less of a man. And can this change over time? Yes, and this is important. As I mentioned, the 2018 the 2018 study showed a clear age-related trend. As men age, collagen and elastic fibers of the penis naturally decrease, so testosterone levels begin to decline around the age of 40, which can affect the tissue quality and erection firmness. Health conditions that reduce blood flow, like diabetes, hypertension, peripheral artery disease, they compound these changes. So a man who is a grower at 30 may find himself closer to a sure pattern at 55. This is not a failure, this is biology. So the goal is not to fight the natural aging process, but to support it through good lifestyle choices, regular checkups, and good conversation with your doctor about sexual health concerns as they arise. So how can you know which one you are? You can measure it yourself. If you are curious, measure your penis in a flaccid state from the base of the shaft at the pubic bone to the tip. Then take the same measurement in the fully erect state. If the difference is greater than 4 centimeters, about 1.5 inches, you fall into the growers category as defined by the current research. And if the difference is less than 4 centimeters, you fall into the showers category. And again, neither the number changes your health, your fertility, or your worth as a partner. It's purely descriptive information. Let me bring this back to James, the patient I mentioned at the start. After I explained all of this to him, the biology, the research, and the age factor, the tissue elasticity, the smooth muscle science, he sat back in his chair, took a deep breath, and said, "So there is really nothing wrong with me." James, I said, "There will never was." That's what I want to leave you with today. Whether you are a grower or you are a shower, your anatomy is normal, your body is valid, and your health is what matters most. And you support that health not by worrying about plastic side, but by exercising regularly, eating well, managing stress, and avoid smoking, and having good conversation with your healthcare provider. The science is clear. The judgment, leave that one at the door. I am Dr. Emmanuel Bale. Stay informed and stay healthy. And remember, taking care of your health is the most important muscular thing you can do. And if this video helped you, please like it, share it with a man who needs to hear it, and subscribe if you have not already. Because next week we are covering another topic that your doctor probably has not told you about. And see you then. Thank you.